Good morning. I'm Dr. Srilakshmi PS from Department of Conservative Dentistry and Endodontics. I'm going to discuss about zinc phosphate cement. The AD specification is number 96. Zinc phosphate cement is one of the oldest luting cement and was introduced by Dr. Otto Hoffmann, and it is mandatory to use a cavity varnish to coat the dental tubules prior to the application of the zinc phosphate cement. Coming to the ideal properties of the cement, first, it is a non-irritant cement, provides good marginal seal to prevent marginal leakage, resistant to dissolution in saliva or other oral fluids, high strength in tension, shear and compression to resist stress at the restoration tooth interface. It provides adequate working and setting time. It also provides good aesthetics, good retention and good thermal and chemical resistance. It is also good opacity. It provides good opacity for diagnostic purposes on radiograph. And finally, it has low film thickness, ideally of 25 microns. Composition. Zinc phosphate cements are available as powder as well as liquid form. So the powder consists of zinc oxide, magnesium oxide, other oxides of bismuth trioxide, silicon dioxide. Whereas the liquid consists of aqueous solution of phosphoric acid and mainly other oxides as well as water. The mode of supply. Zinc phosphate cement is supplied as powder and liquid, which is then dispensed with a pre-measured scoop and dropper. Available types and their clinical application. Zinc phosphate cement is available as type 1 and type 2. Type 1 is a more of a fine grained and provides a less film thickness of 25 millimeter, whereas type 2 is medium grained and provides a film thickness of 40 millimeter. The clinical application of the type 1 is that it is used for luting permanent metallic restorations and cementation of orthodontic bands, whereas the type 2 is a high strength and high strength cement, and it can be used as an insulating base as well. The setting reaction. When the powder is mixed with the liquid, the phosphoric acid attacks the surface of the powder particles and releases zinc ions into the liquid. Aluminium from the liquid reacts with these zinc ions, and then it forms zinc aluminophosphate gel, which is then covered the surface of the unreacted powder particles. The acid-base reaction is exothermic in nature. The powder-liquid ratio. For a base which requires putty-like consistency, powder-liquid ratio about 3.5:1 is used. For luting, which is a more fluid mix, it requires a lower powder-liquid ratio to ensure that there is flow of the cement for luting purposes. Mixing procedure. A correct amount of powder and liquid is dispensed onto the glass slab. The powder is then divided into 4 to 6 increments. The powder is incrementally incorporated into the liquid while spatulating over large area to dissipate the heat produced during the reaction. Initially, smaller portions of powder are incorporated into the liquid. The reasons for this are as follows. The powder quantity being minimal, the heat generated is less. This helps to achieve slow neutralization of liquid and better control of the setting reaction. If large increment is used, the temperature rises rapid and resulting in the cement mix of initial properties. Setting time. The setting time for zinc phosphate cement is between 2.5 to 8 minutes. Method to delay the setting time and prolong the working times are using a frozen glass technique. The frozen glass technique is the most commonly used technique to delay the setting time, and it is by cooling the glass slab in a refrigerator at 6 degrees Celsius or in a freezer at minus 10 degrees Celsius. Working time for this method is increased by 4 to 11 minutes. Manipulation. A properly cooled thick glass slab will help to dissipate the exothermic heat of the reaction. A cool glass slab permits a longer working time and also allows the incorporation of more powder to ensure better physical properties of the cement. A temperature of 18 degree to 24 degrees Celsius would be ideal cooling range. Two consistency for zinc phosphate cements are used. First one is the base consistency, another one is the liquid consistency. And so the base consistency, 3.5:1 ratio is used, whereas for a liquid consistency, a more less powder liquid ratio is used. Properties of zinc phosphate cement. Strength. The cement shows an ideal initial rapid rise in strength reaching 50% of its final strength in first 10 minutes, and thereafter the final strength is reached in 24 hours. The cement has low tensile strength and is also brittle in nature. Adhesion. Zinc phosphate cement has no adhesion to the tooth structure and depends on micro irregularities of the tooth surface to achieve any frictional resistance. Solubility. The cement is highly soluble in water for the first 24 hours. After this, the solubility is negligible, around 0.2 degrees Celsius, 0.2 percentage. Properties. Biocompatibility. The cement has the potential to cause inflammation of the pulp, especially in deep cavities due to the presence of the acid. Insulation. It is an excellent thermal insulator but in thickness of 1 millimeter or more. It is poor electrical insulator due to its porosity, which accommodates moisture, thus encouraging electron transport. Optical properties. It is opaque in nature and does not represent tooth colored materials. Advantages and disadvantages of zinc phosphate cement. The various advantages include that it has got high compressive strength and therefore can be used as a base under amalgam restoration and can withstand condensation forces. It is a good thermal and electrical insulator, effective in reducing galvanic shock induced by dissimilar metallic restorations. The cement has relatively low solubility compared to GIC and zinc oxide eugenol. Disadvantages of the zinc phosphate cements are it is brittle in nature with low tensile strength. It has high modulus of elasticity. It lacks chemical adhesion. Retention is only by mechanical means. It is irritant to the pulp at low pH, which is occurring in the initial stages of the setting reaction. The low pH can cause gross decalcifications. These are the various commercial products that are available in the market and can be used in our daily dental practice.